Namaskar. I am Dr. Manavanjan Jena, Associate Professor, Department of Cardiac Science, IMSO Hospital Bhubaneswar, and Consultant Interventional Cardiologist. Friends, as you know, this is the most difficult time we are going through because of the COVID-19 pandemic all over the world. As a interventional cardiologist, I should say the COVID-19 virus causes severe acute respiratory syndromes in patients, particularly elderly age group, those who are more than 60 years of age, and persons who have coronary artery disease, particularly cardiac disease like coronary artery disease, dilated cardiomyopathies, valvular cardiomyopathies, and congenital heart diseases, and respiratory disease, those who are suffering from COPD, bronchial asthma, interstitial lung disease, cystic fibrosis, or pulmonary tuberculosis, etc. And immunocompromised patients, particularly cancer patients, and persons who are suffering from HIV and AIDS, and persons who smokes continuously, or chronic alcoholics and drug addicts. So in meantime, as a responsible citizens and as well as patients, I should advise something to my patients. During this pandemic period, I should sincerely request my patient, please stay at home and stay safe. If it's not required to go outside, please don't go outside. And particularly my cardiovascular patients, I should say, if you are happy, healthy, and without any signs and symptoms, with the consent of your doctors or cardiologist, you should continue the drugs at least for next 1 month. Again, you have to consult the doctors or cardiologists through digital media or through phone or WhatsApp, anything, and continue the drugs, because you have to continue the drugs for life. Another thing is, in mild and asymptomatic COVID-19 patients, those who are positive and having cardiovascular disease, I should say that they should not panic initially, because in mild asymptomatic patients there should not be any cardiovascular symptoms initially, but as the signs and symptoms become severe, like if there is shortness of breath, chest pain, palpitation, throat pain, then you should not stay at home, because in certain states or certain countries, as per guidelines, patient has to be forced to stay in home because of the less availability of the beds in hospital. So if such type of symptoms appears, then immediately you should rush the hospital, because you may require intensive coronary care unit, or you may require respiratory supports or ventilators. So don't stay at home if there is severe signs and symptoms appears. And particularly we have seen that in young patients, those who have chest pains, throat pain, or palpitations, particularly they are suffering from acute myocarditis because of the cytokine storms or systemic inflammatory response syndromes. And particularly if signs and symptoms is severe and elderly age group, then their cardiac functions or cardiac reserve deteriorates, and cardiac function, once the cardiac function deteriorates, then signs and symptoms will aggravate. There will be more shortness of breath, more chest pain, there may be the bradycardia, there may be swellings of the legs, face, abdomen. So don't stay at home and immediately, because you may require respiratory supports. So, and another thing, or as per research, we have seen that the COVID-19 virus enter to the respiratory systems through angiotensin receptors, angiotensin converting enzymes receptors. So there is certain hopes that persons who are using SC inhibitors or ARB, they should stop the drugs immediately. But my sincere request to my patient, those who are suffering from hypertension or coronary artery disease, or persons who are on ARB or SC inhibitor, they should not stop the drugs. If such things arises, then immediately you consult your cardiologist, because the SC inhibitors or ARB has definite cardiovascular morbidity and mortality benefit. So my sincere request, don't stop the drugs, because these are the very good drugs, and it will definitely control your coronary heart disease and cardiovascular disease. And another things, particularly patients from India, I will tell that, because of fear of coronavirus, many patients, including normal fellows also, they are taking hydroxychloroquine. So my sincere suggest, or my sincere advice to cardiovascular patients, they don't take the hydroxychloroquine drugs if you are a cardiovascular disease or heart disease patients, because The hydroxychloroquine causes sudden cardiac death by arrhythmia because it has QT prolongation effect. So don't take the drugs without the advice of cardiologist. And at last I should say that please don't step out from your home if it is not badly necessity. Take your drugs regularly. Don't stop a single drugs. If you have certain queries or certain problems with the drugs, then you consult your concerned cardiologist immediately through digital media, because nowadays we have seen many digital apps come out to consult your doctors. Continue your drugs. Use mask regularly. Maintain a distance of 6 feet from your fellow. So, and stay safe in your home, and stay safe, because if your safety is our concern. If you stay at home, then we can be safe in our hospital. Thank you.